I can't believe we are quickly approaching the end of 2023. What's new for Medicare in 2024? Hi, I'm Cristina, a registered nurse with a background in care management. I'd like to share the 3 main 2024 changes regarding Medicare with you. Be sure to stay tuned until the end because the last one is very important. Let's dive into it. We are in full swing of the open enrollment period for Medicare, which occurs from October 15th to December 7th. And I'm sure you'll want to be aware of cost changes. The most significant change for premiums in 2024 is the increase for Part B medical insurance. The premiums are projected to increase $10 monthly. There are no significant changes expected for Part A premiums, with most members paying $0. As always, members with Part D or Part C plans should review their annual notice of change for updates or changes in their plans. You'll be able to shop for different plans and enroll into a new plan from now until December 7th. If you'd like to review your Medicare elections with someone, consider our trusted partners at Apollo Insurance Group. Their phone number and website are in the description below the video. The Inflation Reduction Act of 2022 is restructuring much of Prescription Part D. Now you might ask, what is the Inflation Reduction Act, also known as the IRA? And that's a great question. President Biden signed the IRA into law in August of 2022. It comprises a 10-year plan to decrease healthcare costs, among other initiatives. There will be approximately $400 in out-of-pocket savings per enrollee affected by these changes. Even though it is a 10-year plan, we're already going to start seeing savings next year. In 2024, we can expect to see some changes in Part D's 4th coverage phase, the catastrophic phase. The 5% coinsurance will be eliminated, and there will be a threshold set for $8,000. This is significant because currently there is no threshold in the catastrophic phase. This means that individuals with many or expensive medications currently pay thousands of dollars. But with this new change, individuals who do reach that catastrophic coverage phase will find some financial relief, knowing there is an $8,000 cap and they will not have to pay coinsurance. Another significant change in Part D restructuring is the extension of the Extra Help benefit. Extra Help is a Medicare program that offers financial assistance to help pay for prescription medications. Currently, individuals with income of 135 to 150% of the poverty level receive partial benefits, but this act expands full benefits to these individuals. This will allow many more people to get the help they need to take their medications as prescribed. Part D changes also include a price cap on insulin. Although this went into effect this year, it's going to continue in 2024. Part D covered insulin cannot cost more than $35 a month. You also won't have to pay a deductible for the insulin. You'll be able to find more information about insulin supply coverage like syringes, gauze, and alcohol wipes on your plan's formulary or drug list. The last significant change in 2024 regarding Part D restructuring is eliminating cost sharing for adult vaccines recommended by the Advisory Committee on Immunization Practices. That's right, in 2024, recommended vaccines won't cost you anything. For example, a commonly administered vaccine, the shingles vaccine, currently costs most beneficiaries $57 out of pocket. But it will be free to Medicare beneficiaries starting next year. We can look forward to other financially beneficial restructuring changes to Part D in the next few years. Overall, the Congressional Budget Office expects to save $173 billion in healthcare costs with the implementation of the IRA. Medicare is changing some of its benefit offerings in 2024. Today, we're going to highlight the changes that relate to expanded mental health services, chronic pain treatment, and telehealth location limits. First off, expanded mental health services. You'll soon be able to receive mental health care services provided by marriage and family therapists, as well as mental health counselors. Current mental health coverage includes services provided by healthcare providers like psychiatrists and other advanced healthcare practitioners. So this change gives you more options to see therapists and counselors as well. Another new mental health offering includes intensive outpatient program services provided by hospitals, community mental health centers, federally qualified health centers, and rural health clinics. These intensive programs can offer more robust treatments than those provided in a doctor's office. You're still going to be responsible for cost sharing and Part B deductibles for these mental health services, but now they're covered under Part B. Medicare is also expanding chronic pain treatment. Chronic pain is defined as persistent or recurring pain lasting longer than 3 months. Medicare currently covers chronic care management services, but will also now cover chronic pain treatment monthly for services such as pain assessment, medication management, and care coordination. Now let's take a look at some Medicare benefit limitations. Medicare currently covers certain telehealth visits for beneficiaries in any location, even their home. Current telehealth coverage is going to continue throughout 2024, but it's going to change at the end of 2024. Starting in 2025, Medicare will limit telehealth coverage to only those in an office or medical facility in a rural area. Some exceptions do apply, such as if you have end-stage renal disease, symptoms of an acute stroke, services to treat substance use disorder, or behavioral health services. You can read a full list of changes and Medicare benefits applicable in 2024 by clicking on the link in the description to view the Medicare and You guide. If you do decide to make any changes to your Medicare coverage during this open enrollment period, those changes are going to take effect starting January 1st of 2024. Thank you so much for joining me in reviewing some of the 2024 Medicare changes. If you want to figure out how to save on Medicare, check out this video. Also, you can head over to healthnews.com to read our Medicare articles and follow us here on our YouTube channel. Thank you, and I'll see you next time.